What if I told you that a single daily drink, supported by science, could help rebuild your knee cartilage, reduce joint pain, and potentially delay or even avoid surgery? This isn't hype. This is about evidence-based action. And if you're over 60 and struggling with knee pain or stiffness, what I'm about to share could radically shift how you move, feel, and age. I'm Dr. Andrew Huberman, Professor of Neurobiology and Ophthalmology at Stanford School of Medicine. And today we're going to talk about a specific drink, one with clinically supported compounds that targets joint degradation, promotes cartilage regeneration, and optimizes senior mobility. Let's dive into the mechanism, the why, and most importantly, the how. As people age, one of the most common and frustrating issues they face is the gradual breakdown of joint cartilage, especially in the knees. Cartilage is the smooth, rubber-like tissue that cushions the ends of bones and allows for pain-free fluid movement. However, this tissue doesn't have a direct blood supply, which means it doesn't regenerate as easily as other tissues in the body. Over time, through repeated use, minor injuries, and the natural aging process, cartilage begins to wear down. This leads to stiffness, pain, swelling, and reduced mobility, symptoms commonly associated with osteoarthritis. Many seniors are told that this process is simply a part of getting older and that the only long-term solution may be surgery, but that perspective is changing. Recent scientific insights have revealed that cartilage degeneration may not be as irreversible as previously believed. Research is now showing that, under the right conditions, the body has the potential to repair and even regenerate some cartilage tissue. This doesn't mean a complete reversal of years of damage overnight, but it does mean that seniors can take meaningful steps to protect their joints and potentially rebuild lost cartilage. The key is understanding the biological processes that support cartilage health and targeting them with the right nutritional and lifestyle strategies. One of the most promising areas of study focuses on providing the body with the raw materials it needs to support cartilage repair. Cartilage is made primarily of collagen and proteoglycans, and by consuming nutrients that stimulate the production of these compounds, it may be possible to strengthen and restore joint tissue. Researchers have found that supplementing with specific nutrients, such as collagen peptides, certain amino acids, and antioxidants, can activate cells in the joints called chondrocytes, which are responsible for producing and maintaining cartilage. Furthermore, inflammation plays a significant role in cartilage degradation. Chronic, low-grade inflammation, which becomes more common with age, accelerates the breakdown of joint tissue. By addressing this inflammation through dietary choices, supplements, and physical activity, seniors can create a more favorable environment for cartilage preservation and regeneration. The takeaway is that cartilage degeneration should not be viewed as an unchangeable fate. With the right approach, which includes targeted supplementation, a nutrient-rich diet, and consistent movement, seniors can support their joint health in a meaningful way. Scientific evidence now supports the idea that cartilage repair is possible. Slow and steady, yes, but real. This opens the door to more hopeful, proactive strategies for maintaining mobility and reducing pain in later life. Collagen peptide drinks have emerged as one of the most effective and accessible ways for seniors to support joint health, especially when it comes to rebuilding cartilage in the knees. Collagen is a protein that forms the structural foundation of cartilage, tendons, ligaments, and skin. As we age, the body's natural collagen production declines significantly, which leads to weaker joint structures, reduced elasticity, and increased risk of damage. For seniors experiencing knee pain or joint stiffness, this loss of collagen can be a key contributor to their discomfort. When consumed in hydrolyzed form, known as collagen peptides, collagen becomes highly bioavailable. This means the body can absorb and utilize it more efficiently. Studies have shown that a daily intake of approximately 10 grams of collagen peptides can result in measurable improvements in joint function and pain reduction within 8 to 12 weeks. What makes collagen peptides particularly valuable is that they don't just temporarily reduce symptoms. They provide the essential building blocks needed for cartilage regeneration. The body uses the amino acids in collagen, especially glycine, proline, and hydroxyproline, to repair and build new joint tissue. One of the most interesting aspects of collagen supplementation is its ability to stimulate chondrocyte activity. Chondrocytes are specialized cells within cartilage that are responsible for producing and maintaining the extracellular matrix, which includes collagen and proteoglycans. As these cells are stimulated by the presence of collagen peptides, they begin to ramp up the repair and rebuilding process. Over time, this can lead to increased cartilage thickness, improved joint cushioning, and reduced friction between bones, resulting in better mobility and less pain. In clinical trials involving older adults with knee osteoarthritis, those who took collagen peptide supplements consistently reported significant improvements in joint stiffness and function compared to placebo groups. Many of them experienced increased walking distance, reduced swelling, and an overall enhancement in quality of life. These outcomes were not the result of painkillers masking the symptoms, but rather a physiological improvement in joint structure and performance. What makes this intervention so powerful is its simplicity. A daily collagen drink, mixed with water, juice, or a smoothie, offers a low-effort, high-impact strategy for seniors to reclaim joint health. It doesn't require invasive procedures or complicated routines. Instead, it taps into the body's natural repair systems, giving it the resources it needs to rebuild what's been lost. As the research continues to grow, collagen peptide drinks are becoming one of the most recommended options for seniors looking to support long-term knee health and mobility. Collagen alone offers tremendous benefits for joint health, but its effectiveness can be significantly enhanced when combined with specific complementary nutrients. These nutrients work in synergy to amplify the body's ability to rebuild cartilage, reduce inflammation, and maintain overall joint integrity. One of the most essential of these is vitamin C. While many people associate vitamin C with immune support, its role in collagen synthesis is critical. The body cannot properly form or stabilize collagen without adequate vitamin C. It acts as a cofactor in the enzymatic processes that convert amino acids into the collagen triple helix structure. Without enough of it, even the best collagen supplements won't reach their full potential. That's why it's important for seniors to pair their daily collagen intake with a source of vitamin C, whether from food like citrus, fruits, and berries, or from a supplement. Another powerful compound that enhances joint support is hyaluronic acid. This naturally occurring substance is known for its ability to retain moisture, holding up to 1.0 times its weight in water. In the context of joint health, hyaluronic acid plays a vital role in lubricating joints and cushioning the space between bones. It is a major component of synovial fluid, the thick liquid that reduces friction and helps absorb shock during movement. As we age, our natural production of hyaluronic acid declines, leading to drier, stiffer joints. Supplementing with it, often included in high-quality joint formulas, can restore hydration within the joint capsule, making movements smoother and less painful. MSM, or methylsulfonylmethane, is another key nutrient that works hand in hand with collagen. It provides sulfur, a critical element involved in the structure of cartilage and connective tissue. MSM also has well-documented anti-inflammatory properties, which are especially beneficial for seniors dealing with chronic joint pain or swelling. When inflammation is reduced, the body's healing mechanisms function more efficiently, and the materials being delivered to rebuild cartilage are more likely to be utilized properly. This results in a more favorable environment for tissue repair and joint regeneration. Combining these nutrients, collagen peptides, vitamin C, hyaluronic acid, and MSM creates a comprehensive approach to joint recovery. Each ingredient supports a different aspect of the repair process, and together they accelerate results. Rather than relying on collagen in isolation, integrating these synergistic compounds into a daily routine helps ensure that the body not only receives the building blocks for cartilage, but also the tools it needs to assemble them efficiently. This strategy empowers seniors to take control of their joint health with a science-backed multi-layered nutritional foundation. Consistency is the cornerstone of any health intervention, and when it comes to cartilage regeneration in seniors, regular use of targeted nutritional supplements can lead to real, measurable improvements. Studies have shown that seniors who take collagen peptides consistently, especially when combined with synergistic nutrients like vitamin C, hyaluronic acid, and MSM, experience significant physical changes in their joints. These changes aren't just subjective feelings of reduced pain. They are supported by imaging studies, including MRI scans, that reveal actual improvements in cartilage thickness and joint integrity. One of the most compelling aspects of collagen supplementation is its ability to activate the body's natural repair mechanisms. When taken daily, collagen peptides are broken down into amino acids that are absorbed into the bloodstream and delivered to the joints. There, they help stimulate the activity of chondrocytes, the specialized cells responsible for producing and maintaining cartilage. Over a period of weeks, these cells begin to lay down new layers of cartilage matrix, reinforcing joint structure and improving shock absorption. It's a gradual process, but one that leads to lasting improvement rather than a temporary fix. Clinical trials have consistently demonstrated that collagen supplementation leads to a reduction in joint pain, increased flexibility, and enhanced range of motion. In many studies, participants began noticing improvements within 8 to 12 weeks of consistent use. These findings are particularly encouraging for seniors who may be facing limited mobility or considering invasive procedures like knee replacements. By committing to a daily regimen, they can often delay or even avoid surgery while regaining comfort and confidence in everyday movements like walking, climbing stairs, or getting up from a chair. Consistency also plays a role in reducing inflammation, another major factor in joint deterioration. When collagen and its companion nutrients are taken regularly, they help dampen the inflammatory response in the joints, which otherwise contributes to cartilage breakdown and pain. As inflammation decreases and cartilage begins to rebuild, joints move more freely, stiffness is reduced, and the risk of further damage diminishes. Importantly, the benefits of regular supplementation are cumulative. The longer a person maintains this practice, the more opportunity the body has to repair and strengthen its joints. Seniors who stay consistent often report not only physical improvements but also a renewed sense of independence and quality of life. They can engage in daily activities with greater ease, pursue hobbies they once abandoned, and enjoy movement without the shadow of pain or limitation. This makes consistent supplementation not just a health decision, but a gateway to more active, fulfilling living.